this week's clinical assignment, the patient was named Skylar. He arrived to the emergency department with right lower quadrant pain. In the first phase, the nurse did not introduce herself. She did not wash her hands. She did not ID the patient. She did not ask the patient to rate or describe his pain. She should have asked the patient, has this happened before? Is this just a first-time thing? She should have asked the patient if he had any allergies, whether it's medication or food or any other type of allergy. In the second phase, she did not assess the scene when she walked into the room to see if it was safe, if something happened and more than one person needed to come into the room. She did not wash her hands. She also did not ID the patient again. Her mask, she's wearing her mask under her nose. She's not covering her nose, which really defeats the purpose of wearing a mask. She's not wearing gloves. She did not lift the bed rail when she went to the other side of the bed. She left the bed rail down, and therefore when the patient went to roll over on his side, he almost fell out of the bed because the bed rail was not up to help catch him. She did not retake his blood pressure. She just said it's hard to get a reading or something like that. She didn't retake either on that arm or on the other arm again. She should have asked the patient to rate and describe his pain. And she incorrectly took the temperature. There was no covers for the thermometer, so instead she just touched his forehead and face with her hands, which is completely wrong and inappropriate because then you're just guessing. You're not having a set temperature to go off of. For the first question, the vital signs are the priority. An underlying illness that I think would be a kidney stone because of its location and his description. The doctor could order a blood urea nitrogen. He could order a test to know what his calcium levels are. He could order an x-ray, a renal ultrasound, pyelogram, and there's many more tests that he could order to see what exactly the diagnosis is. In phase 4, she did not allow him to rate the pain himself. She just said, oh, you have a 10 out of 10. She did not ID the patient. She did not check the MAR or the medication label. She did not check the correct route. She did not watch the patient take the medication. Instead, she gave it and left, and the patient actually ended up putting the medication in his shirt. He didn't even take it. And she again did not properly take the blood pressure and the temperature. She just guessed again. In the 5th phase, the patient's code status was do not resuscitate. He apparently took a wrong medication that he had an allergy to, which the nurse didn't ask for allergies, so she wouldn't know if he had allergies to any medications. She did not follow the 8 rights of medication administration. She waited too long to check on him. She waited 3 hours to check on him, and within 3 hours anything could happen, and at this point, by the time she checked on him, his allergy to the medication had already set in, and he was not able to breathe. And then there was just improper documentation. She didn't documentate his code status, any allergies, and because she did not document that, whenever she came in to check on the patient, she was trying to resuscitate him, and his wife is the one who tells her he's DNR. She did not document allergies, so therefore she gave a med that he had an allergic reaction to.